So Alastair, as a doctor, how would you actually describe alcohol use disorder?
Alcohol use disorder is a spectrum of severity of illness from alcohol. I'm a doctor who looked after patients with liver disease my whole career, and I would see patients with two different disorders. I often like to think of it that way. They had liver disease due to alcohol, and they had alcohol use disorder, which is a kind of catch-all phrase to try and encompass all different levels of alcohol problems in terms of harmful drinking and then progressing to addiction. So we had to deal with the patient's liver disease, but we also had to deal with their alcohol dependency. How does it develop? It develops usually slowly over time. Every dependent drinker has at one time been simply a heavy drinker, has simply been a light drinker, has been a non-drinker. So it's a natural progression.
Is there a typical person who's affected by alcohol use disorder?
If you could see my patients coming into the clinic and leaving the clinic, you would have no idea that these patients have an alcohol problem. They just look like any other people. Everybody knows somebody whose life is being impacted by alcohol. There's a kind of ripple effect. There's the individual themselves who have the health consequences of this illness. Then there's the close family members, the work colleagues, the wider contacts. So it seems extraordinary to me that such a widespread problem is so little talked about.
So what would you say, talking about alcohol use disorder, are the main misconceptions and misinformations that you've seen in the media?
There's perhaps two aspects of misinformation in the media in relation to alcohol use disorder that I'd like to highlight. The first is perpetuating that view of society, that incorrect view of society, that this is a self-induced illness. It's an individual's choice to start drinking, but it's not an individual's choice for that drinking to turn into an alcohol addiction. That's bad luck, just as developing cancer would be bad luck. So every time it's portrayed that way in the media, that makes the individual with the problem feel worse and feel, yes, I'm to blame here, I'll need to sort this out myself, I can't seek help. The second thing I think is if you just portray it as stereotypes, that dehumanizes it. You're talking about the alcoholic rather than the person behind that, and it reduces the chance to empathize with this individual who's unlucky enough to have this illness.
So what would your dream newspaper article or radio program be if it was talking about alcohol?
Well, I think it would reflect the fact that this is an illness, not the patient's, not the individual's choice. It would reflect the fact that this is an illness which can be treated, that there are people who get better. Let's have an article about somebody who has recovered. In the same way as they do with some other health issues, they should be linking their article to information about where to seek help. Emphasize the safe guidelines. If you're drinking more, should you perhaps go to your doctor to seek help? Should you perhaps get your liver checked out? And where do you do that? So a bit more helping the individual as well as just telling the story.
But the media isn't really an offshoot of Public Health Scotland. So what's in it for them? Why should they be writing your good news stories about alcohol?
I absolutely accept that it's not the media's job to do public health campaigning. I don't think I'm asking you to preach. I think I'm just asking you to present both sides of the story, that it's not all a negative story. Not all people who have alcohol use disorder are drunken louts lying in the gutter. Not everybody has a hopeless case. Many get better. Many are just ordinary people like you and me. Emphasize that human story, maintain balance in the positives and the negatives.
We should be looking at alcohol use disorder as more of a health problem than a social problem, although of course it's both.
Yes, I mean, alcohol use disorder, people who have alcohol use disorder have an illness, and it's important to recognize that and to deal with it as such. When the media are discussing the need for action, or politicians are discussing the need for action, sometimes it's easier to talk about the social disorder aspects of alcohol because people see that. They don't see the health consequences, but the bigger issue is the health consequences. It's 1,000 people that are dying every year directly from alcohol, or the 4,000 that are dying indirectly from alcohol. That's the big issue.
It's been really interesting. It sounds like you're wanting to start a conversation with the media.
Indeed.